read CT scan of the neck. Okay. So next is the pharyngeal mucosal space. So the extent of this space is a continuous mucosal sheet starts from the nasopharynx to hypopharynx, which includes your soft palate. So the relationship of this space to the surrounding spaces, it is medial to the parapharyngeal space and anterior to retropharyngeal space. So the contents of this space consists of your mucosa, salivary glands, PMS, lymphatic ring, constrictor muscles, and the mucosal surfaces of the nasopharynx, oropharynx, and hypopharynx. So the PMS part of the nasopharynx consists of your torus tubarius adenoids, superior constrictor muscle, and levator palatini muscles, while the pharyngeal mucosal space of the oropharynx consists of your anterior and posterior tonsillar pillars, palatine and lingual tonsils, and soft palate. So the fascia enveloping this space is entirely made up of the middle layer of the deep cervical fascia. Okay. However, the entirety of this space is not completely fascia enclosed. Only its posterior and lateral margins are defined by the middle layer of the deep cervical fascia, but its airway side has no fascial margin. Okay. So this image where the star is located is your pharyngeal mucosal space. Okay. As you can see here, this part is made up of the middle layer of the deep cervical fascia, while the airway side has no fascial margin. So, in viewing the CT scan, cross-sectional imaging, this area is your pharyngeal mucosal space. This part, the level of the nasopharynx. Okay. And this part also. Okay. All right. So next we proceed to the masticator space. So the relationship of this space to other spaces. The buccal space is located anteriorly. The parapharyngeal space is located posteromedially. The parotid space is located posteriorly. So the contents of this space is your ramus and condyle of the mandible, cranial nerve 5, branch 3, masseter, medial and lateral pterygoid and temporalis muscles, as well as the pterygoid venous plexus. So the enveloping fascia of this space is made up of the superficial layer of the deep cervical fascia. So these are the relationship of the masticator space and the surrounding spaces. Okay, so now let's proceed to the images. So the image on top of you is where the star is located is your masticator space. Okay, so the image below you is the cross-sectional CT scan imaging. This part is your masticator space. Mm. Okay, another level, masticator space. Just behind it is the parotid space. Okay. So next, we proceed to the parotid space. So the extent of this space, it extends from the external auditory canal and mastoid tip superiorly to below angle of mandible. So the relationships of this space is that parapharyngeal space is located medially, the masticator space is located anteriorly, while the posterior belly of the digastric muscle is located posteromedially. This specific muscle is very important because it separates the parotid space from the carotid space. So the contents of this space consists of your parotid gland, of course, the extracranial uh, nerve 7, intraparotid nodes, retromandibular vein, and external carotid artery. So the enveloping fascia of this space is made up of the superficial layer of the deep cervical fascia. Okay. So for the images, okay. So this part here is the parotid space as pointed by the cursor in cross-sectional CT scan imaging. This part, parotid space. Okay. While the image shown in above the screen is this part where the green color area. That one is the parotid space. So another level, it shows to you the masticator. The parotid space. Okay. So I will also discuss the other spaces within the suprahyoid neck area. So first is the sublingual space. Okay. So this image, okay, it is referred to as the floor of the mouth. This space is located below the tongue and confined by the mylohyoid muscle and hyoid bone. So the contents of this space include the muscles, hypoglossal nerve, lingual artery and vein, sublingual blood and ducts, and a deep portion of the submandibular blood and duct as well as the lymph nodes. Circle. Uh, it is medially to the submandibular spaces with which it freely communicates. Okay. So now we're done with the different spaces within the suprahyoid neck area. So next part is that I will just briefly discuss the different muscles within the suprahyoid region. So we have five suprahyoid muscles. It is comprised of your geniohyoid, mylohyoid, stylohyoid, the anterior and posterior belly of the digastric muscle. So this table is just the summary of those five muscles. So the stylohyoid, so the main action of this muscle is it elevates the hyoid bone. It is supplied by the facial nerve. So next is we have the anterior and posterior belly of the digastric muscle. So for the anterior belly, of course, it elevates the hyoid bone. And its nerve supply is the nerve to the mylohyoid muscle. While the posterior belly, on the other hand, um, it raises the hyoid bone and it's supplied by the facial nerve. So mylohyoid, the action of this is it elevates the bone, the hyoid bone, base of the tongue and the floor of the mouth. So it is also supplied by the nerve to the mylohyoid muscle, just like the anterior belly of the digastric muscle. So and the last muscle is your geniohyoid muscle. Again, it elevates the hyoid bone and protects the hyoid bone. It is supplied by the APR of C1. So the next slide is just the CT scan imaging, which shows the different suprahyoid muscles. So as you can see here, the most lateral part, as pointed by the cursor, is your mylohyoid. This part highlighted by the peach color is your geniohyoid. And this area is your anterior belly of the digastric muscle. And this part, as pointed by the cursor, is your posterior belly of the digastric muscle. Okay. Actually, stylohyoid, the last muscle, I haven't got a CT scan imaging depicting that particular muscle because that specific muscle is kind of thin. It blends with the surrounding soft tissue, so it's really hard to discern that on the CT scan imaging. So that ends my
Sa,
report. Yes, ma'am.
usually sa coronal na MR, kita siya.
Kita mo, Doc? Okay.
Pero sa CT, never
Wala.
mind, no? They just
Okay, Doc.
look for the styloid process and
Mm-mm.
just along the inferior tip nun, any
Mm-mm.
soft tissue density or lesion that you see most likely is affecting the stylohyoid muscle.
Okay. MR
Okay.
pala siya, tita.
Any questions for Dr. Sam? Oh, gets na gets. Ganun mag-aral ng head and neck imaging na. You need to know the spaces.
Mm.
Once, sabi nga ng isang, he practices, I forgot the name of the doctor, he practices in Singapore. Sabi niya, hindi, ang tinatanong daw niya lagi sa fellows niya, sa trainees niya, he always asks, don't describe the lesion. Don't tell me if it's hypoechoic, don't tell me if it's echogenic, etc. Sa ultrasound, no? Just tell me most probably where the lesion is. Even without seeing the images, he could give you 3 to 5 differential diagnoses. No? So, pag kayo consultant na gano'n, then may nagre-refer sa inyo na consultant, ay na residente, if sabihin sa inyo, Doc, mukhang sa submandibular space ko nakita. With that alone, you can have your set of differential diagnosis already. So, the most important thing in head and neck imaging is to know the space. If you know the space, you'll know the structures within it, and most probably, what lesions could affect those structures. Right? Wala questions? Kay Dr. Sam? Ano ulit, just to reiterate, what particular spaces are covered by all the layers of the deep cervical fascia?
Parapharyngeal space po, sir.
And?
And carotid sheath. Carotid space.
Technically, the carotid sheath is composed of 3 layers ng deep cervical fascia. So, huwag kayong malito doon sa mga cervical fascia. May superficial fascia, superficial cervical fascia, may deep cervical fascia. And the deep cervical fascia has a superficial layer of the deep cervical fascia. And may deep layer. No, deep layer of the deep cervical fascia. Okay? Sige, thank you, Sam.
Thank you, Doc. Noel, take the floor.
May weakness sa dumbbells ba?
I am Noel Miguel Carabillo, and I will report today the infrahyoid neck anatomy. So first, the infrahyoid neck. The infrahyoid neck is the region of the neck extending from the hyoid bone, as depicted here by the blue arrow, down to the thoracic inlet. So first is the muscles of the are the infrahyoid muscles, which is summarized here by the table. It comprises of the sternohyoid, sternothyroid, thyrohyoid, and the omohyoid muscles. So the sternohyoid muscle, it depresses and fixes the hyoid bone and draws the hyoid bone underlying larynx, downwards phonation, and the terminal phase of swallowing. The sternothyroid also depresses and fixes the hyoid bone, and the thyrohyoid has the same action of depressing and fixing the hyoid bone and the larynx. It is the sternohyoid, sternothyroid, and the omohyoid inferior belly are innervated by the anterior rami of the C1 to C3 spinal nerves through the ansa cervicalis, while the thyrohyoid is innervated by the anterior rami of the C1 spinal nerve, and the omohyoid, which is the superior belly, is innervated by the superior root of ansa cervicalis. Here is a anatomical image depicting the different muscles of the infrahyoid. The blue one is the blue one in the anatomical left side is the omohyoid, superior belly, and the cervical fascia. These spaces are easily recognized in a CTA shell plane, as depicted here in the image, thyroid, hypopharynx, and cervical esophagus. The carotid space is a paired space. Paired space just lateral to the visceral compartment, which contains the internal carotid, the jugular vein, and several neural structures. The retropharyngeal space, depicted here by the thin yellow region, it is a small virtual space containing only fat, which is continuous with the suprahyoid space and the middle mediastinum. The posterior cervical space is also a paired space, which is posterolateral to the carotid space. The perivertebral space is a large space here in the red region, which completely encircles the vertebral body and includes the pre and paravertebral muscles. So first, we will discuss the visceral space. The visceral space, depicted here by the blue region, is a visceral space that extends from the hyoid to the anterior mediastinum and does not extend into the suprahyoid space. It contains the following: the larynx, hypopharynx, esophagus, trachea, and thyroid gland. So a part of the visceral space is the larynx. The larynx is an inferior continuation of the oropharynx, and it extends from the epiglottis to the inferior aspect of the cricoid cartilage. Inferiorly, it continues as the cervical trachea. The larynx is also a part of the upper respiratory tract. So here is the arterial and venous drainage, arterial supply and venous drainage of the larynx. So above the vocal cords, it is supplied by the superior laryngeal artery, which is a branch of the superior thyroid artery. And below the vocal cords, it is supplied by the inferior laryngeal artery, which is a branch of the inferior thyroid artery. Its venous drainage, above the vocal cords, it drains to the superior laryngeal vein. The superior laryngeal vein accompanies the superior laryngeal artery, and it drains to the superior thyroid vein. While below the vocal cords, it drains to the inferior laryngeal vein and drains to the inferior thyroid vein. So for the lymphatic drainage, supraglottic, the supraglottic lymphatic network fires the superior laryngeal artery, and it pierces the thyroid membrane and then draining into the superior deep cervical nodes and the preepiglottic nodes. Subglottic, the infraglottic lymphatic network drains to the inferior deep cervical nodes following inferior laryngeal artery and or prelaryngeal nodes via the conus elasticus. Both superior and inferior deep cervical nodes then drain into the right and left jugular trunks, which subsequently empty to the right lymphatic duct and the thoracic duct. The innervation of the larynx, for the motor, it is innervated by the recurrent laryngeal nerve and supplies the intrinsic muscles of the larynx apart from the cricothyroid. So for the sensory, above the vocal cords, it is innervated by the internal laryngeal nerve, while below the vocal cords, it is innervated by the recurrent laryngeal nerve. So in this image, this is a eggshell CT image at the level of the glottis showing the true vocal cords, which is depicted here by the stars, and the anterior and the posterior commissures. So here is another image of the larynx. These are eggshell images from CT containing depicting the different parts of the larynx. So the arrowhead here, in the pointed by the arrowhead, is the pre-edge of the epiglottis, while the white arrows depicts the valleculae. The white star represents the pre-epiglottic path, while the black stars depict the black arrow. The paraglottic spaces, while the black arrow shows the hyoid bone. Here in the second image, the arrows shows the two aryepiglottic folds, while the arrowhead shows the piriform sinuses. In the third image, the arrowhead shows the false vocal cords, while the black arrow shows the arytenoid cartilage, while the white arrow shows the thyroid cartilage. So here is a table depicting the muscles of the larynx. As we can see, all muscles are innervated by the recurrent laryngeal nerve, except for the cricothyroid, which is innervated by the external laryngeal nerve. So another part of the visceral space is the hypopharynx. The hypopharynx or the laryngopharynx forms the inferior portion of the pharynx, being the continuation of the oropharynx superiorly and both of the larynx and esophagus inferiorly. It also forms a part of the upper respiratory tract, and its boundaries are in the anteriorly, the postcricoid mucosa and the posterior cricoid arytenoid muscle. Posteriorly, the mucosal wall, middle and inferior constrictor muscles. Superiorly, the hyoid bone, glossopepiglotic and paraepiglottic folds. Inferiorly, the cricoid cartilage and the cricopharyngeus muscle. So this is an HLCT image showing the other parts of the visceral space, which are the trachea, esophagus, and the thyroid gland. So first is the esophagus. The esophagus is a 23 to 37 centimeter long with a diameter of 1 to 2 centimeter and is divided to three parts, which is the cervical part, the thoracic part, and the abdominal part. The cervical part is continuous with the hypopharynx and commences at the lower border of the cricoid cartilage at the level of C5 and C6. The thoracic part is from the thoracic aperture T1 or T1 vertebral body to the esophageal hiatus at the level of the T10 vertebra in the diaphragm, which covers the inferior thoracic aperture. And the abdominal part from the esophageal hiatus continues with the cardia of the stomach, shown here by the arrow, at the gastroesophageal junction. So the arterial supply of the esophagus at the upper third, it is supplied by the inferior thyroid artery, and the middle third supplied by the esophageal branches from the aorta, shown here by the image. The lower third is supplied by the esophageal branches of the left gastric artery. While for the venous drainage, the upper third drains to the inferior thyroid veins, to the brachiocephalic veins. The middle third drains to the azygos vein, to the superior vena cava. And the lower third drains to the left gastric vein, to the portal vein, which is a site of portal systemic collateral pathway. For the lymphatic drainage, the upper third drains to the deep cervical lymph nodes, the middle third at the posterior mediastinal lymph nodes, and the lower third drains to the left gastric and celiac group of lymph nodes. For the innervation, the esophagus is innervated by the sympathetic trunk and the vagal plexus. So another part of the visceral space is the trachea. The trachea is a tube-shaped structure consisting of 15 to 20 D-shaped cartilage rings. It is encircled by the trachealis muscle completely, but is most prominent posteriorly due to the lack of cartilage. So the trachea is supplied by the proximal half is supplied by the tracheoesophageal branches of the inferior thyroid artery, while the distal half and carina are supplied by the superior and middle bronchial arteries. For the venous drainage, the trachea drains to the inferior thyroid venous plexus, and in the lymphatic drainage, it drains to the pretracheal and paratracheal lymph nodes. So the next part of the visceral space is the thyroid gland. The thyroid gland is a single midline endocrine gland in the anterior neck and is responsible for thyroid hormone production. It lies in the visceral space completely enveloped by the pretracheal fascia. The thyroid extends from the C5 to T1 and lies anterior to the thyroid and cricoid cartilage of the larynx and the first 5 or 6 tracheal rings. The thyroid is a butterfly or H shape and is composed of two lobes, the right and the left, each with a superior and inferior fold. Usually, the superior fold is narrower than the inferior fold, giving the thyroid gland a pear-like shape in the lateral lobe. For the blood supply of the thyroid gland, the proximal half is supplied by the tracheoesophageal branches of the inferior thyroid artery, while the distal half and the carina is supplied by the superior and middle bronchial arteries. For the venous drainage, the thyroid gland drains to the inferior thyroid venous plexus, and for the lymphatic drainage, it drains to the pretracheal and paratracheal lymph nodes. So another part of the visceral space is the parathyroid glands. Uh, the parathyroid glands are endocrine glands located at the visceral base of the neck. They produce the parathyroid hormone, which controls the calcium homeostasis. So there are two regions of the parathyroid glands: the superior parathyroid glands, which are located at the posterior aspect of the middle third of the thyroid gland and posterior to the inferior thyroid artery, and the inferior parathyroid glands, which are located lateral to the inferior pole of the thyroid gland, anterior to the inferior thyroid artery. For the arterial supply of the parathyroid glands, the superior parathyroid glands are supplied by the inferior thyroid artery, while the inferior parathyroid glands are supplied by the inferior thyroid artery. For the venous drainage, it drains to the superior middle and inferior thyroid veins, and the lymphatic drainage, it drains to the pretracheal, prelaryngeal, and jugulogastric lymph nodes. For the innervation, sympathetic vasoconstrictor fibers from the middle and inferior cervical ganglia enter the arteries. The next space to be discussed is the carotid space. It extends from the skull base up to the aortic arch, and it transverses to the suprahyoid and the infrahyoid muscles. The boundaries anterior to the carotid space is the anterior cervical space, laterally the posterior cervical space, posteriorly the perivertebral space, and medially the retropharyngeal and visceral space of the neck into the anterior mediastinum. The carotid space is a roughly cylindrical space, as shown here by its shape, that extends from the. It is also circumscribed by the carotid sheath and from all three layers of the deep cervical fascia. Above the carotid bifurcation, the contribution of the middle layer of the cervical fascia and the sheath is interrupted. The carotid artery bifurcation occurs at the level of the hyoid bone. The next space is the retropharyngeal space. The retropharyngeal space extends superiorly to the base of the skull and inferiorly to the posterior mediastinum at the level of the tracheal bifurcation. So, the retropharyngeal space in normal circumstances is a virtual space and only contains the retropharyngeal lymph nodes as well as some fat tissues. Infections from the mouth can spread through this space into up to the posterior mediastinum. There are two other spaces which are in close proximity to the retropharyngeal space, the danger space and the prevertebral space, shown here by the arrow. The danger space actually lies between the alar fascia, which forms the posterior border of the retropharyngeal space, and the prevertebral fascia. It extends from the cranial veins cranial base above to the level of the diaphragm, while the prevertebral space is bounded anteriorly by the prevertebral fascia and posteriorly by the longus colli muscles of the spine. It extends down to the mediastinum and continues to the insertion of the psoas muscle. So the next space is the posterior cervical space. The posterior cervical space is one of the fat-filled deep spaces of the neck, which is located laterally to the carotid space. It contains fat, the accessory nerve, or the cranial nerve 11, and the brachial plexus. The posterior cervical space is related superficially to the sternocleidomastoid and trapezius muscles, deep in the prevertebral space and anterior to the carotid space. And the last space is the perivertebral space, which contains the prevertebral and perivertebral muscles, the brachial plexus, and the vertebral artery and vein. It is bounded anteriorly by the danger space and the retropharyngeal space, posteriorly by the fascia attaches to the splenius rastus and ligamentum nuchae, laterally by the posterior cervical space, superiorly by the base of the skull, and inferiorly bounded from the skull base to the superior mediastinum, but can be extended to the level of the coccyx. Thank you.
Thank you, Noel. Any questions for Noel? Ako may question ako, Noel.
Yes, po,
Para
sir.
sa exam, no? Ano yung, kasi you've mentioned corresponding spaces within the suprahyoid and infrahyoid neck regions. Na. Ano yung mga spaces that would encompass both the suprahyoid and infrahyoid neck?
Supra. Yung ano, sir?
Tatlo yun.
Yung carotid space, sir.
Carotid space, yes.
Retropharyngeal space.
Retropharyngeal or prevertebral or danger space. And, tsaka?
Yung posterior cervical space, sir.
Okay. So, or perivertebral space.
Okay.
Okay, no? So, parehas yun. Laging napapagpalitan yung nalilito yung mga residents minsan sa posterior cervical space at saka yung perivertebral space, no? Pwede ka mag-pull out dyan ng kahit anong axial na image na may muscle.
Sige, Doc. Wait.
When we're talking about the posterior cervical space, we're talking about the fat posterior and medial to the sternocleidomastoid. Yun lang, yung taba lang na yun. Kaya nga, di ba, sabi niyo palagi, there are lymph nodes in the posterior cervical space. Yun siya, no? But the muscle surrounding the vertebra, that's already part na. Yan si posterior cervical space. Okay? Tandaan nyo, yung taba lang yan. Nothing else. It's like para siyang si parapharyngeal space ninyo sa baba. No? It's a fatty structure na ang laman lang niya is nerves at saka lymph nodes. No? So, wag tayong malilito kasi sometimes trainees would put posterior cervical space and they would turo mo yung muscle area, Noel. Sa tabi ng minsan nandiyan yung lesion, then they would call it the posterior cervical space, no? Technically, that's the perivertebral space, no? So that space would encompass both supra and infrahyoid neck regions. Okay? So again, same thing with the suprahyoid neck. Sorry. Just know the location of the lesion, and more or less you can give a good list of differential diagnosis. Now, kadalasan naman ng lesion dyan, unless it's muscular, it's within the posterior cervical space and the visceral space. So most of the lesions that we see for patients who have malignancies are usually along these two spaces. Sa posterior cervical space, hanap ka ng metastatic lymph node diseases. Sa visceral space naman, hanap ka naman ng primary malignancy, particularly sa larynx, hypopharynx. Okay? Walang questions? Okay. Kila Noel and Sam? La. Actually, maganda, okay magbasa ng head and neck kasi yun lang, you just look for the space and the only problem is most of the structures are very small and they are confined in a very small region. That's why not all trainees or not all radiologists want to read or do head and neck imaging kasi ang daming titignan. But yun, technically kung titignan nyo, madali siyang basahin kasi you just need to know kaya you'll see some of my readings talaga. The lesion is centered, di ba? Ginaganon ko. Kung nasaan siyang hindi ka magkakamali. Kahit naman lumabas dyan na for example, if you see a well-enhancing lesion in the masticator space and which appears to enlarge the muscle groups. So isipin mo lang, it's just a sarcomatous lesion, no? Or it's a lesion affecting the nerve innervating that particular muscle, no? Wala ka naman ng iba. You won't think of glands, you won't glandular tumors, you won't think of pleomorphic adenomas, no? In those spaces kasi alam mo, ang laman lang nun, muscle at saka nerve, no? Siguro ang magulo lang palagi, dalawa lang ang magulo na pahihirapan tayo talaga, no? Sa bata, may fellows ba? So, sa bata kasi, there are certain lesions that are multi-spatial, no? Hindi ibig sabihin special, I mean spatial, multiple spaces, no? So, particularly your lymphangioma or cystic hygroma, usually, it would affect several spaces. And for both the adults and pediatric patients, abscesses talaga, no? Abscesses kasi it doesn't hindi siya bounded by fascial boundaries, no? So even if it affects it is centered in the carotid space, it could easily go to the parapharyngeal, pharyngeal mucosal, and even to the perivertebral spaces. Okay? So,
Okay, sir.
okay yung lecture today, no? So, keep in mind na ganyan. Ito palagi, hindi to nawawala sa mga lectures. You can ask Dr. sila Butch, sila Tin, sila Orsi na lagi natin, ito yung pangbungad natin palagi for head and neck imaging. Even for conventions and RTC meetings or in scientific meetings niyo, ganito palagi yung pambungad ng mga head and neck radiologists. Spaces muna. Okay? Meron pa bang lectures? Etong dalawa lang?
Wala na po, sir.
Wala na. Okay. Sige. I-download ko lang yung mga cases tapos mag-Zoom meet tayo ulit. Siguro after 30 minutes per an hour. No?
Okay.
Sino bang CTP resident?
Kami po ni Sam, sir.
Okay. Toxic ba? Hindi naman.
Doon interview eh.
May apat na
okay.
tayong interview si Sam, Doc.
But last night, yung kailangan na basahin right now.
Dalawa lang daw po.
Okay, sige. Download ko. Lang kasi cellphone lang itong gamit ko ngayon. Hindi tayo makapagtanapin na. Okay. Thank you.
Thank you, sir.
Ano sabi?